that the duodenum with the submucosal glands is not the esophagus with its esophageal glands.
Because of the crypts?
The crypts are not going to be the most distinctive feature. You said because of the smooth muscle, but we have that in the distal esophagus. Gina? There's no cilia anywhere. Glands?
Oh, the microvilli.
The microvilli can be hard to see, though. What's the epithelium of the esophagus? Of the esophagus? Stratified squamous epithelium wet. That is your huge indicator that you're in the esophagus. The villi is your big visual indicator that you're in the small intestine. Okay? Because a submucosal gland is a submucosal gland. They can look very similar. Yes? Yes. Yes. Because the glands are proximal esophagus only, and the skeletal muscle is best developed in the proximal esophagus. All right, so I'm back down to scanning power. I told you we're looking at the ileum. And as we look, we've got taller villi now. Okay? So in the duodenum, we didn't have such well-developed villi. Here they're really leaf-like, really long villi. So we do have a lot more surface area here than we had in the duodenum. Okay? And it is simple columnar epithelium. The white spots are the occasional goblet cells going up and over the villus. The filling of the villus is lamina propria. And inside the lamina propria of every villus is a blood capillary and a lacteal, a branch of a lymphatic vessel. Read about that, and I'll talk about that next Tuesday. We're going to go deep to that, and as we get to the base of the villi, so kind of the true surface of the organ, we have these inward structures. We're going to ignore all this purple stuff for a minute. We have these inward structures. Those are the intestinal crypts. Okay? So an outie is a villus, an innie is the intestinal crypt. Those are both features of the tunica mucosa. The muscularis mucosa is just barely visible here. Now mind you, I'm still at low power. So from here up is mucosa. Okay? Now what I want to do, I'm staying at this power because I want to show you this overwhelming structure. Remember when I told you slide together and sit shoulder to shoulder? That would be an aggregation of what? Lymphatic nodules. Nodule, 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 shoulder to shoulder. That's an aggregated lymphatic or lymphoid nodule. Okay? They're not organs. They're clusters of B cells and T cells and maybe some monocytes that are inside connective tissue deep to an epithelium lining. We find them elsewhere. We have tonsils on our tongue, for example. So a node, a lymph node, has nodules inside of it, but the node is a complete organ. This is just a structure. So they are the overwhelming feature of the layer submucosa. We don't see much of the fibrous connective tissue except for here at the base, because they're just filling the submucosa. And in places they're so abundant that the lymphocytes have spilled over into the lamina propria. So we're really protecting here against invasion of potentially pathogenic organisms, viruses, and largely E. coli bacteria. As we get, and you can go along, so they are not present along the entire length of or around the entire circle, but there's patches of them. So this is submucosa where the lymphatic nodule is not present, where the aggregated lymphatic nodules. And their eponym name is Peyer's patch. As we get deep to that, there's our muscularis externa, very nice and organized, very tidy. In fact, we can see the tunica mucosa, the submucosa, the muscularis externa with its inner circular layer, its outer longitudinal layer, okay? And if we go up close and personal, that was at very low power, you should be able to recognize smooth muscle tissue. And if we get on this outer edge and it hasn't been disrupted, we may be able to pick up the simple columnar epithelium cap of the serosa, but I'm just really not seeing it clearly developed. It's very easy to dislodge with their knife blade. So I'm just picking up, and you weren't looking at quite the same thing. I'm just picking up a few cells that are probably simple squamous. I don't see enough of them to show you for sure tunica serosa. We'll probably see that on another slide. So this is our cross section of the longitudinal fibers. You need to be cautious not to call this the longitudinal layer just because you're seeing the cells along their long axis. All this tells us is that if this circular layer, we're seeing the long axis, then we're looking at a cross section of that organ, okay? Because when we have a cross section, the circular layer, we'll see the long axis of the cells. In the circular layer, the longitudinal layer, the cells will be cut in transverse section. So it's not where we're seeing the axis or long axis of the cell. We just really have to memorize the inner layer is the circular layer. And we can use that to build information on what our section is, a cross section or a longitudinal section. The slide label should tell that as well, and this slide label does say cross section. I do want to point out, you might see what you think are striations here. This was a chatter in their histology blade, in their microtome, which created what looks like striations. So that was a mistake. They should have thrown this tissue away in terms of that. That's a bad image. But the rest of the slide's very good. And we got low quality slides. They're getting worse as we order them. Okay, so now I'm going back to the middle, the jejunum. And here we have villi. So this is a villus, this is a villus, but we have this forest of villi, and there's many of them that are tipping over the top, and so when the knife blade comes down, it gets just a section of it. It doesn't get it where its base continues with the rest of the mucosa. So these are cut off villi, and we'd have to scan along to find a place where we see continuity with the rest of the wall. So here's a short villus again, okay? Mucosal epithelium going over the surface, simple columnar epithelium with microvilli, lamina propria filling the center, intestinal crypts coming down into the lamina propria below the surface, and then muscularis mucosa at the deep edge of the tunica mucosa. This is submucosa, and the thing about the jejunum, and I'll show you this because this is coming up, very nice artery and vein. Remember, the submucosa is highly vascularized, okay? But as we go to low power so that we can do a quick scan of the submucosa, we have villi, so what organ are we in? The intestines, small or large? Small intestines. So then we go to the submucosa, we have blood vessels, but we're looking for glands or aggregated lymphatic nodules. But only blood vessels is what I've seen. No. So we have a plane, if you will, submucosa. So this is jejunum. This is not near either end, okay? The small intestine in the middle. We do see the muscularis externa, nicely presented. you can see that the inner layer, the circular layer, is thicker than the longitudinal layer, and it would get even thicker if it was a sphincter, but this is jejunum, so there's no sphincter. Okay. All right, so there's only one more, and it is the colon slide, and you'll be learning the colon word. That is part of the large intestine. The cecum is part of the large intestine with its appendix. The colon, excuse me, and then the rectum. So 3 regions to the large intestine, and we're looking at colon. And the colon is further subdivided into an ascending colon, transverse colon, descending colon. Those subdivisions of the colon are not present on the cat. Okay? The cat's colon is much shorter than the human. So here we're at the lumen, and we do see a smooth surface to the lumen with a lot of inward projections of that lumen. Okay? These inward projections are called the same thing they were called in the small intestine. These are intestinal crypts. Okay? So we don't differentiate them by name, which may or may not confuse you, but it's one less thing to learn. But we certainly can differentiate them visually. The intestinal crypts become almost exclusively goblet cells here in the large intestine. So the fact that we have no villi, as long as you don't mistakenly think that this is a villus and this is a villus. This is the surface. There's nothing outward from the surface. There's only inward from the surface. Okay? I'm going to go over here and show you this surface is going up and over a fold. So if I go to scanning power, we're going up and over a fold here, and the fold is a fold of not just the mucosa, but it's filled with submucosa. Okay, so this is what we call a ruga. And in the submucosa, we do have a lymphatic nodule. In the colon, we have lymphatic nodules. What we don't have is the shoulder-to-shoulder Peyer's patch. We don't have aggregated lymphatic nodules. And generally, they're smaller. They don't take up the full thickness of the submucosa. So if we stay away from that fold, it's a lot easier. And here's a little lymphatic nodule, okay? Totally separate from the other one. So this is a nice view with a flat surface of the lining of the colon, the intestinal crypts, lined by the simple columnar epithelium of the mucosal epithelium, goes over the top and comes into the next crypt. Lamina propria is the sublayer that the intestinal crypts are embedded in, and muscularis mucosa is this red ribbon here.
What's the red ribbon?
Muscularis mucosa, the 3rd sublayer of the mucosa. This is submucosa, a main layer. Looks pretty fibrous. And as we get deep to that, we have the muscularis externa, circular layer, longitudinal layer. Okay. And we're in the colon. As we come outside of it, we do have a serosa here, and we see a cellular cap to the fibrous connective tissue, indicating that this is a serosa and not an adventitia. So we're most likely looking at transverse colon or sigmoid colon, because the ascending and descending colon are retroperitoneal. So we can go up one more power, but this is the mesothelium. We've got disruption of the loose connective tissue. This should be adjacent to and connected by the connective tissue to the muscularis. See if we have it a little less disrupted down here. Yeah, it's a little more continuous right along here. This is the tunica serosa. Okay. So, that's it. This is the most extensive histology of any of the organ systems. It teaches you a lot And then we'll do much less, fewer slides per system and less per slide as we go forward quickly through other organ systems.